Hi, my name's Keisha. My last pap smear was in July 2015.
I'm Jackie, and I've never had a pap smear, and I've never even been to the gynecologist.
I'm Carmelita, and I've never had a pap smear.
Hi, my name is Chelsea, and my last pap smear was 6 months ago.
I'm Steph, and I've never had a pap smear.
Cervical cancer is cancer of the cervix. The cervix is that part of the uterus that's located at its base and opens into the vagina. Cervical cancer is a common cancer in South Africa and is the second commonest cancer affecting women in this country. 70% of cervical cancers are caused by the human papillomavirus, which is a sexually transmitted virus. This virus can be prevented by vaccinating young boys and girls above the age of 9 years. Unfortunately, cervical cancer presents as an advanced disease in over half the people in whom it's diagnosed. And when it's advanced, most patients will die from this disease. The recommendation is that sexually active women be screened on a regular basis looking to pick up this disease at an early stage. This screening is done by a pap smear, looking for abnormal cells. If found early, cervical cancer can be easily cured.
After my initial diagnosis 2 years ago, I was all clear for 18 months, but I found out that my cervical cancer has spread to my lymph nodes and I'm once again in treatment.
Hi, my name is Kathleen, and I was diagnosed with cervical cancer in 2012. I never thought this would happen to me. I never thought I'd get that phone call where my test results came back and my world turned upside down. My GP phoned and said, "Come in so we can go over your results." My heart sank. Once all my test results came back, it was clear that I had cervical cancer and that I had to go for a radical hysterectomy. The road to recovery was long, it was hard. But luckily I didn't have to have any chemo or radiation. I still go for regular checkups every year just to make sure that everything is fine. I knew I needed to go for a pap smear once a year, but nobody ever really explained why. I didn't even realize that there was an HPV vaccination that could aid in preventing cervical cancer. Throughout all of this, I realized that cancer does not discriminate. I've always been very maternal, so to be told that I won't be able to carry my own baby was devastating. 5 years later, I still battle watching programs about babies. I feel like I've been robbed. It's very, very difficult to come to terms with. You never know what life's going to throw at you. I live my life one day at a time, taking advantage of every moment that I have. I'm truly blessed with the friends and family that I have. Without them, I wouldn't have been able to get through this ordeal. No matter what life throws at you, you are stronger than you think you are.
Hi, I'm Marinda. I was in the habit of going for a pap smear once a year. When my gynae picked up abnormal cells, he told me to come back in 6 months' time. I didn't know any better, so that's what I did. Again, he told me to come back in 6 months' time, so by the time I was diagnosed, the cancer had spread and a whole year had passed. If I had known better, I would have insisted on extensive testing just to make sure that there was nothing to worry about. I'd never feared cancer. The thought never even crossed my mind. In my mind, disease was something that happened to other people. I was fit, I was healthy. So while I was waiting for the results of the tests, I really wasn't worried. Despite my symptoms and the statistics, I genuinely didn't think it could happen to me, but then it did. I have a wonderful support structure, but I'm so tired of giving people bad news that I don't really want to talk to anyone. I wish I could tell them I'm okay, but I'm not. I ended up only telling a handful of people because it was so difficult for me to deal with their emotions while trying to deal with my own emotions. I spent so much time staring at the ceiling and just trying to process. I had friends who prayed for me and I really believed that I would be healed, but I didn't know what that healing would look like. It was terrifying. Because the cancer had spread, a hysterectomy wasn't an option, so I ended up going for chemotherapy and 26 rounds of radiation. There's a fellow patient who said, "You're not the boss of anything right now," and that is a brilliant summary of cancer. It removes the bossness in you. Every day, cancer tries to steal something from me. My joy, my friends, work, normality, life itself. Every day is a battle not to allow that to happen. I came to a point where I had to decide whether I wanted to live or not. Intellectually, I know you don't have control over that, but the desire to live does something for your state of mind. Today, I decided that I want to live. It sounds trivial, but I believe it's a decision I had to make in order to move forward. I am too young to die. If I die now, what kind of legacy will I be leaving? I haven't impacted enough lives, so I choose to live. Today was a better day than most days last week. Besides going to chemotherapy and radiation, I spent most of my time at home because the treatment side effects were so severe. My friends took turns to take me to radiation treatments. They sat with me holding my hand while I was undergoing chemotherapy. I don't know what I would have done without them. I'm so thankful for them. Today I'm completely healed. This ordeal has just changed my perspective on life completely, and I've got so much to be thankful for.